I think sometimes we need to be really aware that young people need tools and pathways and steps to get through problems that maybe we take for granted, you know, as part of growing up, but for them they're big issues. So SPARX gives them a practical way to go through those steps, and I think if they can do that, then they'll be much more resilient about problems they're going to, you know, face in life.
What I think is really great about the game is that it takes what may seem like really huge and impossible problems and breaks them down for you into smaller steps you can take and makes finding a solution seem achievable.
SPARX came about following a conversation that I had with a good friend of mine who's a general practitioner. What we've realised over the last couple of decades is that depression is very common in the community, and it starts in mid-adolescence with rates climbing very steeply between the ages of 15 and 18. And we also know that about 3/4 of young people who suffer from low mood during this time never get any help for this. And she and I were talking about how we might change that, and she said to me, I think you should put cognitive behavioural therapy onto a CD-ROM so that I can run it into my general practice. And that kind of set the scene, and here we are 10 years later with SPARX Online.
Tenakwe haere mai. Welcome to SPARX.
SPARX is an online self-help tool. It uses a fantasy game format, so the idea is to try and get help across using techniques that we usually use in therapy, using a fantasy game format so you can choose an avatar and go into a fantasy world and undertake a number of challenges.
My brief was to develop something quite interactive for young people that was different from the other e-therapy tools out there. We knew we wanted to make it interactive and animated and quite fun.
One of the challenges with creating SPARX was that we needed to make sure that it was applicable to Māori young people. So we wanted to ensure that there was characters within the game that not only spoke some reo, but they also had perhaps a Māori accent.
We've tested SPARX in a clinical trial, and we've shown that it's very effective. It's as good as the sort of treatment that young people usually get in face-to-face counselling, and it's also been very popular both with young people, but we've also had a lot of international attention about it.